There is a kind of damage that does not announce itself. It does not arrive with sharp pain or a sudden warning. It builds quietly over months and years in the space between ordinary moments. The chair you sit in every morning, the underwear you have worn for decades, the coffee you reach for before anything else. And by the time most men over 50 notice something has changed, the change has already been happening for a long time. I want to talk to you today about 10 habits that fall into this category. Not dramatic behaviors, not obvious risks. Ordinary everyday things that men do without a second thought. Things that are slowly, silently restricting blood flow to one of the most sensitive and telling parts of the male body. Because here is what most men do not realize. The penis is not separate from your cardiovascular system. It is a direct reflection of it. The tiny vessels that supply blood to erectile tissue are among the smallest in the entire body. Smaller, in fact, than the vessels that supply your heart. They are the first to show signs of damage when circulation is compromised, which means that changes in sexual function are often not just a bedroom problem. They are a whole body signal, arriving early, asking to be heard. Let me walk you through what I see most often in men over 50. The habits that look harmless, but are quietly working against them. The first is wearing tight underwear throughout the day. It seems like a small thing, a preference, not a health decision. But the groin is designed to stay cooler than the rest of the body. That lower temperature is essential for hormone production, tissue health, and long-term erectile function. When underwear is too tight, it traps heat, compresses delicate blood vessels, and creates a restricted environment that the body was never designed to tolerate for 12 hours at a time. Over months and years, this quiet compression contributes to declining testosterone and reduced circulation to exactly the tissues that depend on circulation most. Switching to breathable, looser fabrics and sleeping without tight garments entirely gives the body the nightly reset it needs. The second habit is sitting for long, unbroken hours. This one is almost universal among men who work desk jobs or have settled into quieter routines after 50. Prolonged sitting places constant pressure on the pelvic floor, compresses the nerves that run through the lower pelvis, and slows the circulation that keeps erectile tissue healthy and responsive. The damage is cumulative and invisible. You do not feel it happening. But over time, men notice that erections are less reliable, less firm, or slower to arrive. That is the body communicating what the posture has been doing quietly for years. Standing up once per hour, stretching the hips, taking a short walk, these are not luxuries, they are maintenance. The third habit is ignoring morning erections, or more precisely, ignoring when they stop appearing. A firm morning erection is not simply a curiosity, it is a clinical signal. It reflects the quality of your circulation, the health of your nervous system, and the current state of your testosterone levels. When morning erections become less frequent or less firm, that shift deserves attention. Not alarm, but attention. It is the body's earliest and clearest language, spoken before symptoms become impossible to ignore. The fourth habit involves alcohol and tobacco, even in what feels like modest amounts. A drink in the evening, a cigarette under stress. Neither feels significant in isolation. But alcohol temporarily suppresses testosterone and dulls the nervous system's ability to respond to arousal. and tobacco, even occasionally, constricts blood vessels and reduces nitric oxide, the molecule that signals blood vessels to open and allows an erection to form. These effects are not dramatic after a single instance, but across years, they reshape the vascular landscape in ways that accumulate quietly and become increasingly difficult to reverse. The fifth habit is relying on medication without addressing the underlying cause. This is perhaps the pattern I find most difficult to watch because it is so understandable. A man notices difficulty staying firm. He reaches for a pill. It works. Then it works a little less well. Then the dose increases. But the pill was never designed to repair the root cause. It was designed to assist a system that was still fundamentally functional. When the system itself has been eroded by inflammation, poor circulation, chronic stress, and years of sedentary living, medication becomes a temporary bridge over a widening gap. The men I have seen make genuine, lasting progress are the ones who treated the bridge as a starting point, not a destination, who use the assistance to buy time while they address the foundation. The sixth habit is neglecting the pelvic floor entirely. Most men over 50 have never deliberately engaged these muscles in their lives. The pelvic floor is the deep muscular base that supports the bladder, controls ejaculation, and critically, helps trap blood inside the penis once an erection begins. When these muscles weaken through years of inactivity and prolonged sitting, erections become harder to maintain even when blood flow is adequate. Strengthening them requires almost no equipment and very little time. A slow exhale while gently lifting the muscles at the base of the pelvis, held for a few seconds and released. Done daily, this simple practice begins to rebuild the infrastructure that supports sexual function from the inside. The seventh habit is chronic, unmanaged stress. Stress produces cortisol. Cortisol constricts blood vessels, suppresses testosterone production, and keeps the nervous system in a state of alert that is fundamentally incompatible with sexual function. A body under siege redirects resources away from reproduction and towards survival. This is not a psychological weakness, it is biology. But when stress becomes a permanent background hum of a man's daily life, the body eventually stops distinguishing between a genuine emergency and a difficult afternoon. The result is chronically elevated cortisol, chronically suppressed testosterone, and a vascular system that is perpetually tightened rather than open. Sleep, movement, and deliberate rest are not indulgences. They are the primary tools for managing this. The eighth habit is poor sleep quality, which is closely tied to stress, but deserves its own recognition. Most testosterone is produced during deep sleep. When sleep is fragmented, shallow, or insufficient, whether due to stress, poor habits, or the sleep disruptions that become more common after 50, testosterone production drops, erectile function declines, mood and energy follow. The connection between sleep and sexual health is direct, measurable, and frequently underestimated by men who have normalized years of inadequate rest. The ninth habit is chronic dehydration. The body is largely composed of water. Blood viscosity, how thick or thin the blood flows, is directly affected by hydration. When a man is chronically underhydrated, blood thickens slightly, circulation slows, and the small vessels that supply erectile tissue are among the first to feel the effect. Most men over 50 are mildly dehydrated for significant portions of the day without realizing it. The fix is not complicated. But like most things that matter, it requires consistency. The 10th habit is silence. Carrying these concerns alone, without speaking to anyone, without seeking information or support. The men I have seen suffer most are not the ones with the most severe physical issues. They are the ones who waited the longest before having an honest conversation. With a doctor, with a partner, with themselves. Silence allows small problems to become large ones. It allows fixable patterns to calcify into permanent limitations. And it carries its own weight, a quiet, grinding sense of shame that has no basis in reality, but feels entirely real to the man carrying it. None of these habits is irreversible. The body, even past 50, even past 60, retains a remarkable capacity to respond when the conditions change. Blood vessels can regain flexibility, hormonal balance can shift, circulation can improve. The men who discover this are almost always the ones who stop waiting for a dramatic intervention and started paying attention to the ordinary details of how they were living. 1 cup of water more per day, 1 walk around the block, 1 honest conversation with a physician. The changes that matter rarely begin with heroic effort. They begin with small decisions, made consistently, that accumulate into something the body can finally work with. Your body has been sending signals. The question is whether you are ready to listen. If something in this conversation landed for you, if you recognized a habit, or 2, or 5, I want to hear about it. Leave a comment below and tell me which one surprised you most. And if you want to go deeper, subscribe. Because next week I am going to walk through something that builds directly on this. The specific foods that silently accelerate vascular damage in men over 50, and the ones that begin to reverse it. That information changes how men think about every meal. You will not want to miss it.